Hi everyone, so we're going to start our next unit called joints. So this is very closely related to our skeletal unit, but talking a little bit more about their connections here. So joints or articulations are functional junctions between our bones. So we're going to talk about these different junctions here. So different functions that we're going to see. They bind our parts of the skeletal system, bind our different bones. They allow for growth. So one of our joints would be an epiphyseal disc. That's something that we would consider to be a joint here. They allow our body parts to move. So our bones are not fused together, which we know. So these joints, these in between parts of our bones, are going to allow that movement that we have in our body as well. And then it also permits parts of the skeleton to change shape during childbirth. So a good example of this is our skull and those epiphyseal discs as well. There's 3 different classifications that we're going to give to joints. So our first is going to be fibrous joints. So these are bones that are firmly fastened, not connected. Well, they are connected, but they aren't fused bones. They're fastened by this fibrous, dense connective tissue. Those would be fibrous joints. So some different ones are syndesmoses. This is 2 bones joined by a ligament. And then amphrotic means that these are slightly movable. So that is going to be an important part here. So amphrotic means slightly movable. So an example would be the internus ligament of our fibula and our tibia. So if we see, this is that ligament that we are talking about right here. It allows for a little bit of movement between our tibia and our fibula, but not too much that these bones will have full range of motion. So this would be in there. Our next one is our sutures. So we see sutures found between the flat bones of our skull. Those are going to hold those different bones together very tightly. So adjacent bones will grow together and they're united by this suture ligament or our suture lines that we see in our skull. So an example is our lambdoidal suture. And these are synthrotic, meaning immovable. So after those bones have grown to our full size, they are no longer movable. We'll see these suture lines occur. So we can see really small, very close together is this dense connective tissue that is holding those bones of our skull together, called sutures. Our next one is Gomphosis. These are formed by a union of cone-shaped bony processes in a bony socket. So it might sound a little bit weird, but a good example of this is how our teeth are fastened to our jawbone, and that's called a periodontal ligament that holds our teeth to our mandible and our maxilla. And these again are synthrotic, which means immovable. So if we see this tiny little hair-like looking structures that are around our tooth here, is that periodontal ligament that is holding our tooth to our jawbone that is right here, either our mandible or our maxilla. Our next one is collagenous joints. So these are hyaline or fibrocartilage that connects bones together. So again, synchrondosis, bones are joined by hyaline cartilage. An example is that epiphyseal disc that's between our sternum and our ribs. So our epiphyseal disc in our long bones, and then that cartilage that connects our bones in our sternum. We talked about that costal cartilage. So that is an example of a collagenous joint. And then these are synthrotic, which means not very movable at all. So if we take a look, all of this cartilage right here, our costal cartilage that's holding our ribs to our sternum here. That's a great example of this first one for our collagenous joints. Next is our symphysis. So remember we talked about two bones that are connected by fibrocartilage, and we can see an example of that between our symphysis pubis, which is in our pelvis, and then we can also see these types of cartilage in our vertebrae column between each of our discs to help cushion the weight of our bodies on our vertebrae. So these are amthrotic, so these are a little bit movable, which is going to be important, especially in that pelvis because of that movement that needs to occur during childbirth. And then, of course, our spine, we need to move our spine to move around. So if we take a look, we can see this little bit of cartilage that's found here in our symphysis pubis, and then we see these really thick discs of cartilage between all of our vertebrae. That's really going to help that cushioning of the weight of our bodies as we walk around, sit, do any type of movement like that. So that's where we're going to stop. We're going to talk about our last kind next time.